This is Sheila Power with Regis College, completing my psychiatric assessment narrative video. I want to thank you for taking the time to schedule an appointment to visit with me today. I'm aware that making that phone call to schedule an appointment for therapy can be stressful, and I commend you for making the decision to better your situation. Before we begin the process of discussing why you have come in today, I'd like to complete some bookkeeping that the agency requires. I'd like to go over the informed consent, please. First of all, psychological services. As I mentioned, you've taken a tremendous step by coming in today. Talking to someone about the problems in your life is very effective in helping to overcome certain obstacles. Like many other treatment techniques, psychotherapy and the use of psychotropic medications most often proves to be very beneficial. However, there can be side effects. Persons being evaluated or involved in treatment may experience a wide range of emotions, and it's not unusual to feel vulnerable or stressed. Therapy may arouse feelings or produce insights of which you were unaware or which you may not wish to experience. While the goals of psychological services are to advance the understanding of problems and to increase functioning and well-being, it's sometimes possible that symptoms may not improve. Any problems or uncomfortable feelings you may experience can be discussed during our meeting times. During our first two meetings, I want to take the opportunity to learn about you and your goals for therapy. I'm going to ask you some questions about your family of origin, stressors in your life, medical issues you may be experiencing, any issues you may be currently experiencing or in the past with substance abuse and safety concerns that you may be experiencing as well. After I've had the opportunity to thoroughly evaluate your needs, I'll develop a treatment plan, and I'll share this plan with you and ask for your agreement with the plan. Please let me know if you feel the plan addresses the needs in your life. And remember, therapy is an investment in time, money, and self, and you need to be certain that you feel comfortable in this investment. If at any time you feel uncomfortable with me or with the plan I've developed, let me know, and I'll be happy to refer you to a professional with whom you might have a better fit. Our scheduled meetings, initially I'm going to ask you to meet with me weekly for 60 minutes, and then once we begin to make some progress in therapy, we may just need to meet every other week. Once I schedule your appointment, I will require that you provide 24-hour notice if you can't attend your scheduled session. If you don't give me 24 hours of notice, there'll be a $50 fee that's not covered by your insurance. Attending scheduled sessions is a very important part of your treatment. If there are multiple canceled appointments caused by circumstances that were not beyond your control, I'll talk with you about maybe ending our professional relationship. Your cost of treatment depends on your insurance coverage and your ability to pay, and there are several fee schedules. Generally, I ask my office staff to inform my patients of the fees and discuss all that before our first meeting. All your payment arrangements should be completed before beginning the therapy. Failure to consistently pay for services provided may result in services being suspended until your account is current. If you need to contact me, I know generally our visits are by appointment only. So if you have an urgent need and you feel you need to speak with me outside of your scheduled appointment time, please speak with my office staff and leave a detailed message. I'll return your call within 24 hours, usually less. If you're experiencing a crisis, please contact the crisis center or call 911. If it's necessary that I have to be away from the office for an extended period of time, I'm going to make arrangements with a colleague for you to schedule an appointment so we continue your therapy. As far as confidentiality, our discussions are protected by law, and I won't discuss your care with anybody that you don't designate in writing, who you might want information disclosed to. With your consent, I may also discuss your individual case with other colleagues of mine, but I'll do everything I can not to violate your confidentiality. Now, there are some exceptions to patient-provider confidentiality. I do have to report any abuse, suspected of abuse of someone under 18 years of age, suspected abuse, neglect, or exploitation of an elderly person, and I'm going to have to report threats made by my patients to themselves or to others, especially if there have been previous acts of violence towards somebody else. And I'm required to contact either the threatened individual, law enforcement, or to seek hospitalization for stabilization. Minors and parents, unless a patient is over the age of 18 or emancipated by the courts, the law allows parents full access to psychological records. It's been my practice to ask parents to agree if the minor would rather their records not be viewed by the parents, to please not ask me to show the records or discuss the records, rather than just basic treatment information. Only if the minor consents to more detailed disclosure, then we can talk with the parents. If any client arrives for an appointment who I suspect may be under the influence of drugs or alcohol, you'll be asked to take a drug test. And if you refuse to be tested, you'll have to be removed from the building by security. Anybody testing positive for drugs or alcohol, or any client who admits to being under drugs or alcohol, will be asked to contact somebody to drive them home for their safety. And if you choose to drive yourself, then we'll have to call law enforcement to keep you safe. We'll have to then discuss return to treatment, whether or not this is appropriate for you. Finally, your signature on this form indicates that you've read and reviewed the consent for treatment and you don't have any objections to any part of it. Biopsychosocial assessment. I'm so glad to see you today, and I hope you're excited about this process that we're starting together. Today I'm going to ask you some questions so I have a good understanding of who you are. I'll be asking you questions about your physical health, your sleep patterns, your family members, your education, certain stressors in your life, as well as some other questions that will allow me to know how I can best be of assistance to you and help you to meet your goals for therapy. Are you comfortable answering these questions for me? Great, let's get started. First of all, tell me where you live. What's your marital status? Tell me who lives in the home with you. And is there someone I can contact in case of emergency? Is English your primary language? Do you receive any type of services such as food stamps, Medicaid, maybe disability or TANF? And what about your housing? Do you have someplace to live? Are you renting someplace, or you own? Do you live with somebody? Are you living out in the country or in the town? Are you currently working? And tell me where you work. Do you enjoy your job? And do you plan to stay at that job, or are you looking for something different? Are you a student? Where are you going to school? What are you studying? You told me you have 12 people living in your home. Are all of those your children? If not, where are your other children? And what stressors are present in the home? Does everyone get along? Is there violence? What about alcohol or drugs in the home? So tell me why you've come in to see me today. What issues are you experiencing that are stressful for you? Is there domestic violence that you'd like to discuss? And how do you see your life improving by coming here? Do you have enough food in your home? Any issues with hoarding food, binge eating currently or in the past? Same with anorexia. Do you have special dietary needs? Or do you have concerns about your weight? What about pain? Are there any issues with physical pain? Are you taking prescription medication? Tell me about your pain. Is it chronic? Where is your pain? Can you rate your pain for me? Tell me about your family. Is there any history of mental illness such as schizophrenia, depression, bipolar disorder, Alzheimer's disease, anxiety, learning disorders, developmental delays, ADD, ADHD, incarceration? Does that apply to your mother, father, siblings, aunt? How about your uncles or your grandparents? Are you satisfied with family relationships and your social relationships? Tell me about your activities that you enjoy. What do you do in your community, or what about your church? Have you ever been incarcerated, or do you have pending criminal charges? Are you having any difficulty caring for yourself? Are you able to bathe yourself, dress yourself, prepare your meals, drive yourself, do your own shopping? And do you have any problem hearing or seeing? What about ongoing dental issues that are unaddressed? Tell me some about your education. How far did you go in school? Are you still going to school? What do you like to do for fun? Do you spend time with your family? Do you fish? Do you enjoy music? What about the casinos or the clubs and bars? Do you play a sport? Do you like to be outdoors or hunting? What about family relationships? Can you tell me about that? Does your family support your treatment today? On a scale of 1 to 5, how supportive would you say your family is of your treatment? What about significant losses in your life? Can you tell me about any deaths or abandonments or traumatic events that you've experienced? What about spiritual or your cultural practices? What's important to you about your culture? Do you practice a specific religion or attend a church? Are you involved with a traditional healer? Can you describe your spiritual beliefs, and are they important to you in your life, and how do those help you? Have you ever in the past, are you currently using alcohol or cannabis, cocaine, methamphetamine, mushrooms, hallucinogens, opioids, sedatives, designer drugs? Do you smoke tobacco or chew tobacco? What about vaping? Do you use a lot of caffeine? How much caffeine would you say that you drink in a day? Are you currently or have you ever used IV drugs? Tell me about the consequences of your drug abuse or use. Have you been arrested? Ever had an overdose? Had a blackout? A DUI? Been involved in a homicide? Have you ever had a GI bleed? Liver disease? Has it caused relationship problems? Do you have any history of abuse, or are you currently experiencing abuse? Have you been put down, threatened, made to feel afraid, shoved or kicked, maybe bitten or forced or coerced to have sex? By whom and how old were you? Were these incidents reported? Can you tell me what the outcome was after reporting? Do you witness in the past? Have you witnessed in the past? Are you currently witnessing violence in your family? I know these are hard questions, but we're almost finished. Tell me about your physical health. Do you have chronic medical conditions? Tell me some about those. And what about your access to medical care? Are you able to see a physician regularly? Do you have good health insurance? What about prescriptions? Can you pay for your prescriptions? You've done a really great job today. Some of these questions are so difficult to answer, but I appreciate your honesty. I'm going to use all of this information to develop a treatment plan that we can begin working on shortly. Does that sound like something that you feel like you're ready to do? Great. Let's schedule your next appointment. Remember, if you need anything before I see you again, please call my office staff. I'll return your call within 24 hours.